And another reason to wear your mask, hospitals across North Alabama are seeing record numbers of COVID patients, and case numbers continue to rise at alarming rates. Nearly 2,300 people in the state are testing positive each week, and officials say that number needs to stay below 1,000 for hospitals to manage. Our Kelly Kennedy tells us how hospitals in the valley are keeping up with the demand.
We're talking about alternatives for space for a morgue. Okay, this is as real as it gets.
During an already busy season for hospitals, more and more people are dying from and being hospitalized with COVID-19. Because health officials expect this trend to last well into January, the Huntsville hospital system is already making changes, like increasing restrictions for visitors and stopping elective inpatient surgeries at most of their hospitals.
The reason you eliminate inpatient first is because you need the beds. And the nurses and the staff that take care of overnight inpatient surgical patients can be used more easily or more readily to take care of inpatients.
But it's not space they are most worried about. They say the problem is not having enough staff. Right now, 230 healthcare workers in the Huntsville hospital system are out due to COVID. On top of that, hospital officials say we're losing many nurses to other states because Alabama doesn't have the resources to pay all nurses a competitive price.
We cannot afford to lose the caregivers and healthcare professionals who provide the care we need, and especially for the critically ill with coronavirus.
Models predict hospitalizations in the state could double before we're even out of the current surge. If the trend now continues, hospitals will have to pull workers from other units.
It's not easy to take a nurse that's been working in surgery for 20 years and all of a sudden have them go to a floor and take care of a COVID patient. It's a totally different work environment for them.
The Huntsville hospital system is actively recruiting nurses. They have hired over 100 new nurses that will finish up training and start in January. Putting the Valley first, Kelly Kennedy, WZDX News.